After working with over 10,000 people dealing with back, butt, and sciatica pain, data in my experience suggests that about 50% of the people who I work with have symptoms that are driven centrally via their brain, learned neural pathways, not due to physical damage within their body. And so in this video, I want to share with you 3 movement-based clues that your pain is caused by your mind, not your body. And this video is going to be perfect for you if doctors seem confused about the cause of your symptoms because nothing makes sense or matches up. Symptoms are just kind of weird and all over the place. You're frustrated because you find it challenging to find or identify what's working versus that which is not. You're confused because you feel fine while you're doing things, but later things flare up and you're not really sure why. If exercise and treatment tends to work temporarily, but the problem always comes back, then this could be part of the long-term solution for you. And if you're stuck and you want to learn why you hurt and you're interested in, again, how you can heal yourself naturally without having to rely on others to fix you, and again, this is a fit. So in this video, you will learn, all right, a super simple 6-part movement exam that lays the foundation for figuring out why you hurt, the cause of your pain, and what to do about it, and how the relationship between the things that aggravate you, the emotions that make you feel worse, and the pain that triggers your symptoms, we call these pain triggers, can be used as diagnostic clues or evidence that your symptoms are of the mind versus body. We're going to lay out the 3 distinct clues that indicate symptoms are more psychological than they are physical. And I'm going to share some real case studies of folks who I've worked with who have given me permission to share their stories, who, based upon the response to movement, discovered symptoms were of their mind, not what they thought, not of their body. All right. And just so you know, I want to share this briefly, that this comes from someone who works in the trenches with people like you every single day. My name is Dr. Charlie Johnson. I'm a physical therapist, doctor of physical therapy, orthopedic board specialty, residency trained, and only treat people with back, butt, and sciatica problems. So this knowledge and experience places me in the top 0.5% of PTs in the United States. This is all I do. This is my specialty. I'm passionate about helping people like you. All right, I've seen over 10,000 clinical cases. And so again, this is all backed by experience, that which you're about to learn. All right. So one of the first steps to determine the most likely source of your back, butt, or sciatica pain is to begin collecting data. There's value in data collection, not just rushing to the solution and trying to, get better overnight. That's great if it happens, right? But there's value in collecting the data in a way that you can begin to see, feel, and understand. And I bring every single person through this standardized movement exam, and we record which motions are yucky and to what extent. And I would recommend that you start this video doing the same exact thing rather than just jumping through this and trying to speed it up. All right, this is very valuable. So these are the 6 motions that make up something I call the total body scan. All right. And the purpose of this scan or this self-assessment, knowing that you're the person in pain, I believe that you have the most potential to solve your own problem. It's just you're not sure exactly what to do with when I do this, it hurts. And what does that mean? Right. So this is really useful. You know what you're feeling better than I do or what anybody else does. So the total body scan is not designed to flare you up. It's simply to help you explore, right, how your body responds to different motions. And so the goal is not to push through pain, but instead to start to become aware of what feels good and what doesn't. And an important distinction here, as a rule of thumb, yucky motions are motions that reproduce your specific pain or problem in the back, butt, or leg. So now let's go step by step through the total body scan and test each of these motions one by one. So we're going to do 1 rep, 1 at a time, right? And we're going to record the results. And to record the results, basically how yucky any of these motions are, we're going to use this, I don't know, we'll call it yummy yucky scale. All right. And we've got low, medium, high. So as you work through these motions, you're going to ask yourself, okay, is it yucky or is it not? And is it low, medium, or high? And the higher the number, the more yucky or aggravating or painful or symptomatic the motion is. Low, medium, high. If it's low, is it a 10, 20, 30? Medium, 40, 50, 60. High, 70, 80, 90. All right. So what you'll get at the end of this, right, is essentially sort of a readout of how your body responds to different motions. So you can see here, total body scan. These are all the motions that we will go through. And again, we'll either rate them as, hey, they don't bother me at all, so that's yummy. Or you can see here, leg raise right was low yucky, and they marked it as a 20. Right? Here's another example. And so you'll see that responses can be all over the board. It's okay if all motions feel completely yummy. It's okay if no motions feel yummy, and you have lots of yucky motions. All of that is totally okay. Just play it as it lies and go through this process. All right, so let's do it. So start by taking a seat and twisting your trunk to the right. You can always go back to this, and I would recommend that you go step by step through this. Again, as this sort of lays the foundation for collecting valuable data so that we can determine, all right, based off the results of this data, what does this mean? What doesn't this mean? Start by doing a seated trunk twist to the right. And again, is it yucky? Right? If it's not yucky and it doesn't reproduce your pain or problem, you mark it as yummy. But is it yucky? If so, is it low, medium, or high? And then you give it a number. Right? You give it a score. Now we're going to go to the left. Twist your body to the left. Is it yucky or not? Score it. To what extent? Pull your right knee to your chest. Again, I'd suggest that you go back and you do this. Pull your left knee to your chest. Do the same thing. Yucky or not, give it a score. Right ankle, sort of in a figure 4 position on your left knee, and let it fall naturally as if you're sort of cutting your toenails or tying your shoes or something like that. Figure 4 left. Now we're going to do leg raise. Start with your legs straight. You can relax back against the chair. Heel on the ground and raise your right leg up. Is it yucky or not? Give it a score. And if it doesn't reproduce anything, it's yummy. You don't need to give it a score. Now let's do the left leg. Now bend your body forward as you reach towards the floor between your legs. Is it yucky or not? Now we're going to go over the right knee. Put your hands on your right knee and bend forward over the right leg. Now we're going to go over towards the left knee. Now we're going to stand on up, feet shoulder width apart, hands on your back or on your hips, and you're just going to bend backwards. Yucky or not? If it's yucky, give it a number, low, medium, high, and score it. Now we're going to twist to the right and bend straight backwards. Yucky or not, and score it. Other side, twist to the left and bend straight backwards. Give it a score, or again, if it's not problematic, no symptoms, it's yummy. Something happened. You moved your body in different ways, or backwards, right, left, you kind of twisted it, and you scored each of these things, or they didn't cause any problems, you marked them as yummy. And so now what I want you to do, this is a sample of what I want you to do. So now you've got your scores to all these different motions. Go back, replay the video if you need. This is really important. Don't skip this step. What I want you to do is I want you to highlight your top 3 yucky motions, and then also record what we call your top 3 pain triggers. So we have all this data on the left side of the screen here, and you're going to record your top 3 yucky motions. So for example, you can see here, there's 80, 80, 60. All right, so we've got trunk twist right. We wrote that there. Figure 4 left, 80. And forward bend left, 60. We just need top 3 yucky motions. And then your pain triggers are things which trigger your symptoms or aggravate your pain. These are not the motions on the left side of the screen here. These are things like sitting, driving, gardening, walking, swimming, jumping, biking, hiking. These are activities or positions. So you put top 3 yucky motions above, pull those out from all the data you have, and then identify or list pain triggers, and then score those. So in this example, getting up from a seated position is number 1. That's yucky. It's problematic. It's a pain trigger. How yucky is it? Is it low? Is it medium? Is it high? Okay, it's medium. Is it 40, 50, or 60? Yeah, it's probably about a 50. Great. Walking fast, a 40. Prolonged sitting or driving in the car, 60. Don't obsess too much over the scores here. Put a base score, collect the data, pull out your top 3 yucky motions, and then identify 3 main pain triggers. Spend a minute or 2 to do that. And this is the data you need that sets the stage for beginning to identify if symptoms are more of the mind or more of the body. And we're going to show you exactly how we're going to do that here in a second. So look, now you've identified your yucky motions or lack thereof. Again, it's okay if you have no yucky motions and everything's yummy. It's very possible that happened, along with your top 3 pain triggers. Now watch and listen closely to see if the data you collected and your pain experience relates to any of the 3 scenarios I'm about to share. Again, we're going to actually share some real live case studies and conversations I've had with people to see if you resonate, all right, and to drive these clues home, all right? So the first clue is symptoms are more of the mind versus the body, all right, is that your yucky emotions are inconsistent with your yucky positions or activities, your pain triggers, and things just don't match up. And so I'm going to share an actual conversation I had here with a woman named Shannon, and then also with a woman named Angela. I'm going to pull up all of their data and help you see how with Angela, symptoms are very much of the body. With Shannon, symptoms are not as clear and consistent, which suggests symptoms are of the mind. So let's jump into it. And again, listen to the nuggets and just understand the concept that I'm about to show you.
When I was doing the testing for the different motions, like, yeah, some of those would hurt, but it was like, there's other motions, just like I said, just standing hurts. Like, that's the worst. I'm like, how is just standing, hurting.
It's a position. So what you will
Yeah.
see is that you will see inconsistency between the exam and what people actually feel. So for example, let me highlight this for you. So I'm doing this for a reason. All right.
Okay.
Angela has pain with back bending. All right.
Yeah.
Back bend right, back bend left, and a leg raise. Her symptoms. What if her symptoms are structural? She has symptoms with back bend right, back bend left, and leg raise left. If her symptoms are mechanical of the body in origin, what activities will she not be able to do?
Back bends and left
Back
leg.
bends, right,
Left.
and left leg raise. But how do those things show up in life?
Walking, standing.
Yeah, yeah. She won't be able to. She won't be able to stand, or she will have trouble. When I say won't, you will see. If I this is all I knew based off of someone, and they said, "Tell me if this person's symptoms are of the mind or of the body." After doing this thousands of times, I would say, if of the body, one clue, I don't know anything else. Remember, I'm just going this blind. Let's just say this is all I had of the picture. This is someone's self-exam results. If it's of the body, that person is going to say, I have trouble standing, or weight bearing of some form. I have trouble walking because walking moves you closer to a back bend as you kick your legs back. And I have trouble driving and maybe sitting because that is a leg raise. Okay, now, Charlie, we're going to reveal the results. Ready? Survey says, ding, ding, ding. I could pretty much guarantee this is a structural problem based off of what... There's such consistency there. It makes sense. When things make sense, and when there's a clear consistency between the yucky motions and the integrated activities or pain triggers that someone has, it tells me probably structural.
Okay.
Now, for you, okay, here we go. All right. We zoom in, and we say, this is Charlie, this is all you got. Forward bend center, forward bend right, figure four left. She's going to, I would say, if structural, she's going to have trouble lifting, which it sounds like you do. Standing is going to be fine. Walking is probably going to be fine because she has no backward yucky motions. She's going to hate sitting, and she's going to hate driving because that is a forward bend, and that is a figure four left, and that is these yucky motions, how they would show up. Survey says doesn't match up.
Yeah. I get what
Yeah,
you're saying.
and so look, this is one clue. Notice how I'm not here to just take one clue and throw anybody just in jail for one thing. But I would start to say, if this is all I had after reviewing thousands of these, and that's why I look at the data, I would say that's starting to not make sense. If somebody on their case review, when they submit it, say, hey, I have trouble with a back bend, right? And then like their yucky activity is sitting. I'm like that, and then stress makes it worse. Then delayed symptoms. Then I tried this. Then distraction makes it. You're not looking like you've got what they tell you is wrong with you. You've got a centrally driven source of symptoms because it doesn't match up. You see yucky individual emotions, which are not matching with integrated activities. And therefore, that is something that symptoms may be of the mind and or it's one clue. And then, by the way, we look at evidence list, and that's what it also suggests.
All right, so there you have it. Pain caused by physical damage or structural pain, as you can see with Angela, presents with a very clear and consistent movement pain relationship. There's a direct match between their yucky emotions and the things that they can't do. It's very predictable. Yucky emotions are clear, they're consistent, they match up with the positions or activities which are painful. We just saw that. In other words, one can predict which positions or activities will be painful in life if given one's yucky emotions, and vice versa. You can also reverse it. If given the painful positions or activities or pain triggers, the yucky emotions which make these things up will be also present in the movement exam. All right. So again, your yucky motions, if symptoms are structural of the body, will predict the yucky positions or activities that you will experience, and then vice versa. Right. So if you tell me the yucky positions or activities, then I'll know the yucky motions that you will have if symptoms are due to structural damage within the body. For example, let's go a little bit further to kind of show this visually, what I mean. Right? So let's just say you have a yucky knee to chest and a seated forward bend, or just one or the other. So just a yucky knee to chest and only, and then maybe just a yucky forward bend only. Recognize they're very similar. All right. So a knee to chest is this motion of the body, this C shape, if you will. All right. Forward bend is essentially the same thing, just from above now. All right. And so if you have a yucky knee to chest, you will say, if symptoms are structural, that you have trouble sitting and leaning in to do your work, that you have trouble sitting in a bucket seat, that you have trouble sleeping in a fetal position, or going on all fours and pushing back in child's pose or yoga. That sitting in your bed to read at night on your iPad or out of a booklet is painful and problematic. That squats are fairly yucky. Why? Because these positions or activities, these triggers, if you will, they are a knee to chest, and that is how that knee to chest shows up in life, right? The same could be true. If you told me, Charlie, I have trouble sitting in the car, I have trouble sleeping in a fetal position, I have trouble doing squats or reading in bed, and I'm going to say, well, I can predict the motion that you have trouble with, and it's going to be a knee to chest or a forward bend, again, because they're very much the same. One's from above, one's from below. Right. And again, this is an example. Because we collect this data and so many data points, we can start to see these trends, which allows us to really refine our process of helping people like you. So leg raise right 100, figure four right 100, forward bend center, super yuck, right? You can see this person, their pain triggers or the things that aggravate their symptoms match up with those yucky motions. In other words, how would these yucky motions show up in life? A leg raised right, a figure four right, a forward bend center. Well, they all move my body into this acute C-shaped position in some way, shape, or form, right? So this person is going to have trouble sitting, probably sleeping on their side, or maybe their leg falls across, which puts them in this little bit of a crossover position of their leg, a figure four, getting in and out of a car because they have to bend forward and kind of go into that forward flex position. This just matches up and it makes sense with there being a structural source of symptoms. Now, let's just say you have a yucky figure four. Right? Yucky figure four, you're going to have trouble crossing your legs, sitting Indian style. You're going to say, hey, Charlie, I went to PT. They gave me this figure four piriformis stretch, and I thought it was helping. It hurts so good in the moment, but it's actually not really working long-term, or it's making me worse. Doing pigeon pose is going to be problematic. Again, crossing the legs while you're sitting. Or reading or doing whatever. Also, sitting and being in a twisted position places a similar type of load on the hip. Sitting knock-kneed, standing with your feet closer together and weight shifting, kind of hanging all your load on that hip, again, starts to cross that leg towards the midline, towards that figure four position. And again, vice versa. You could tell me you have trouble with any of these motions, and I'm going to be able to predict that a figure four is more than likely problematic for you. Right? So there should be a match there. Now, if you have trouble with the leg raise on one side, the right side, the left side, or both sides, this is the form, if you will. And so we have to ask ourselves, how does that form show up in life? If I have trouble doing a leg raise, then I should have trouble with these things. Well, here are these things. You're going to have trouble sitting with your legs straight out. You're going to have trouble stretching your hamstrings, as in this picture. So if you go to PT and they have you stretching your hamstrings or doing sciatic nerve glides, that's going to make you worse, most likely, not better. You're most likely going to have trouble driving, depending on the leg, but our legs are generally more stretched out when we're driving. You're not going to be able to canoe or sit in a kayak because your legs are out in front of you. Running or even walking is going to be problematic as you have to reach for the next step, that is moving you closer to a leg raise. Sleeping, if you're not careful and your leg kicks out a little bit, that is again putting you into that leg raise position, downward dog, all that stuff, all yuckiness. Vice versa, if you tell me what you can't do, I can tell you what motions will be yucky, right? And so here is consistency with somebody who had yucky motions of the leg raise right, leg raise left, and also figure four, which we just talked about. And we can see it. There's a direct correlation and a match. It just makes sense between the motions that they present with that are yucky and the triggers or the things that aggravate their symptoms, right? Leg raise left and right, that is driving. Getting in and out of the car, that is forward bending and moving closer to that leg raise as you have to bend forward to get out. Sitting also kind of brings us closer to that figure four or closer to the C-shaped position, which is a leg raise. Everything makes sense here. And the most likely source of this, just based off this little bit of data, is something that is structural in origin, right? A problem with the body, a disc problem, sciatic nerve issue, piriformis issue, something like that. Let's just say you have trouble with none of those things, but you have a yucky back bend. Well, then if the problem is of the body, structural, then you're going to have a different presentation within the things or the activities / triggers that cause your symptoms to become worse. So if you have a yucky back bend, you're going to say, hey, Charlie, sleeping on my belly is super yucky. Sitting up tall is also making me worse because that good posture, quote unquote, is actually pushing you closer to a back bend. So in this case, a McKenzie lumbar roll is going to make you worse if you have a yucky back bend because that's how that back bend shows up in you sitting. All right. Press-ups and cobras are going to make you worse. Walking, especially as that leg kicks back, is likely going to be problematic. Maybe even standing, especially if you have a sway back, as it moves you closer to that yucky back bend. All right. Again, vice versa. Tell me what you can't do, and you're going to have a yucky back bend. I can predict the yucky motion. All right. And just another example of someone we worked with who shows consistency between yucky motions, especially going backwards, back bend center, back bend left, leg raise left. So they're going to have trouble standing because that, again, is closer to a back bend. They're going to have trouble going from a forward position to that back bend, migrating into that backwards bend or that more upright posture of their spine. And they're going to have trouble walking, not only as they extend their leg, which is a leg raise on the left side at some point, but also because as they put that leg back, it pushes them closer to a back bend motion, which is yucky. And so everything here makes sense from a structural standpoint, being the most likely source of symptoms. All right. So yucky motions, which are inconsistent with yucky positions or activities or triggers, things don't match up, are a sign that your symptoms are being driven centrally by your brain, not your body. And you saw that sort of contrast or juxtaposition within Angela. Things were very consistent versus Shannon. Things were not very consistent. All right. So that's why I presented that as an example. All right. The second clue that symptoms are more of the mind versus body is that it's difficult to find clear and consistent yucky motions, or all motions are yummy, but certain positions or activities are yucky. So maybe you went through and you're like, hey, Charlie, pretty much everything was good. It's just these positions or activities that I can't do. Motions were fine, right? This is actually very common. So Churchill says, hey, I can't find painful motions. Am I the only one who can't seem to experience pain from any of the motions in the total body scan? I only feel pain while lying down out of natural spine alignment, like say on a soft bed or memory foam or something like that. Sitting and standing, positions, that's it for me. I just can't seem to pose without pain, but motion, not really a problem. Is this weird? Should I just fill in the motion slots in my worksheet with something random for now? This is where you start to see people make things up because they think it's so odd. They have no yucky motions, but they have certain yucky positions or activities. And therefore they say, Charlie, I don't think you can help me because, well, no motions make me worse. So how are you going to problem solve this? Right? It's because you're so glued to the outcome and the standard way of thinking that you don't recognize that no pattern is the pattern. Just because things aren't clear and consistent and others have not been able to help you doesn't mean that someone like myself is not able to help you and that we can't identify what this feedback actually means, right? So for example, this person here, lots of yummy motions and then a little bit of yuckiness with the leg raise right. All right, and so you can see here, they don't even really know what to put in their yucky motions because nothing's really that yucky. But you can see that they have significant problems driving and sitting and sleeping. This person has all yummy motions, but for some reason, they just can't have sex. They can't lie down and sleep, and they can't sit, all right? And so you see that they made up their top 3 yucky motions because they had to put something in there, right? They wanted to try to like make it fit, make it work. But you don't need to make it work. You just play it as it lies. You don't try to josh the data. Don't judge the data. Just look at the data for what it is. If you don't understand it, then you reach out to a specialist or someone like myself. So lying down with straight legs, lying down with fetal position, sitting straight for 5 minutes. They didn't really know what to put in there. You can see they kind of put pain triggers in the yucky motions. Here's another example. Almost all yummy motions, but a knee to chest is like maybe a 10. I just got to put something in there, Charlie. Otherwise, I feel like you won't be able to help. Right? So again, nothing really yucky motion wise, but you can see sitting on a soft surface with knees elevated, 90, 80, 60, lots of pain with certain positions and activities, lots of pain triggers, but no yucky motions. This is weird. And so what I want to do is introduce you to a man named Ed who worked with me privately inside my Glute Relief Accelerator program. He's allowed me to share this experience with you. And this is a perfect conversation, an example of somebody who has all yummy motions or inconsistency in their response to motions. They have a hard time determining if something's yucky or not. It's kind of like, hey, you know, the symptoms are just there, but nothing really makes it worse motion-wise in the total body scan. But I can't sit. I can't drive. I can't do things like that. So check it out. And again, listen for any of the nuggets and listen to me help him understand why he's experiencing what he's experiencing.
Okay, so you can load the hip. I could ask you to jump on the hip, right, on the right side there. Yeah. Hamstring, glute. I could ask you to do like a single leg deadlift. No weight even. And you would be like, hey, I'm pretty good.
Yeah. Oh,
good.
Yeah. Yes.
Good. Okay. So now, right, what you're saying is, hey, I don't really have any yucky motion specifically. I primarily have pain with positioning positions. Activities that involve me sitting or whatever.
Yeah, like anything that's anything that is like, so I'm at work right now and I'm sitting on a wooden chair.
Yep.
I can't sit on a soft surface.
Okay, got it. Cool.
For whatever reason, all of a sudden it just starts like, and I don't even know exactly where the pain is. You know what I mean? Like it just starts. I just start getting like starts flaring up. And then, in pain and discomfort, I'm doing this. And the only way that helps is I have my lacrosse ball here.
Yeah.
And like, let's say I'm going into a meeting or something, I'm bringing this and I just stick it right into my like hamstring area.
Yeah.
And for whatever reason that, that fixes the problem. Like all of a sudden the pain is gone. Like I'm in no pain right now.
Yeah. Yeah, I get it. Yep.
It's just like if I go sit on an airplane, if I go sit on, like I went and watched my girlfriend's parents' place, we went and watched Oppenheimer, right? And they have I brought a lacrosse ball to sit on while I'm watching because they have this, cushy couch. So it's just stuff like that. And then like laying on a mattress, for example. If I'm laying down and I don't have, that'll cause pain. And it usually is worse. Like I went to a restaurant a couple of weeks back, and it's one of those, it's Austin. It's got these like hip, whatever seats, and it's not a regular table. It's like you sit outside and you sit in these comfy little like hip chairs. Well, the chair ends up being this like you're almost in a squat. Your knees are up here, and you're just sinking into this thing. And I mean, that's probably the worst pain I've had in quite some time. I was like, guys, I gotta get out. This is ridiculous. But that's the worst. If you really sink into that thing and knees are above parallel, like they're like that's awful.
Okay. But you can pull your knees up to that position now, and it won't hurt. Like you can move your hip all around.
Yeah, this is fine.
Cool.
Okay.
So where I would say no question, if you have certain activities that are yucky or positions that are yucky, but you can do all the individual motions which make up that activity or that position, and it's no problem, then it starts to be weird. Meaning, if I say to you, hey, I have trouble swimming. Charlie, I can't swim because my shoulder hurts.
Yeah.
But then I bring you through an exam and you go.
Yeah.
And you say, dude, my shoulder doesn't hurt though. And I'm like, okay, but what is swimming? Swimming is this. We'll go do it right now. It's fine. But then you can't swim?
Yeah.
You see how like the lawyer in you would be like,
yeah,
wait a second, something's not adding up.
Yeah, that's true. Because if I went and squatted right now, like I got a barbell and squatted, which is basically the activity that I'm talking about, I'd be fine. I could do that tomorrow. I could do that right now.
Yeah. So if you're telling me, if I was to draw it out, right, you're telling me, hey, this is the form that's yucky, me sitting in that knee to chest, right? Yeah. But I could actively load up a barbell or do no weight with that. And I could do a lunge this way, and I could do a lunge this way, and I could do this, and I could do that, and I could kick my leg. I could kick a soccer ball. We could go running. I could go for a sprint. I might hurt my calves because I haven't done it in a while. I might be out of shape. I might fall over. But exactly. It's not because of the pain or the symptoms. But then when I get in that position, I'm going to blame that position as the cause of my pain. I'm going to say, that doesn't sound mechanical at all, man. Something's weird. And if it's weird, it's usually wired.
Another example, meet Elaine. No yucky emotions. Charlie, how can you possibly help me, right? How am I going to use movement as medicine if I can't identify anything that needs treated? Right? Well, this person has pain, right? So they do need treated. And so, again, listen closely in this example to hear Elaine's experience and how she sort of came to this aha moment of symptoms not being driven structurally by her body, but instead being due to her mind.
When I look, for example, at your movement exam and I see, man, she's describing these symptoms, but she doesn't really have any clear yucky emotions. She has some yucky activities, right? But she doesn't really have motions that are yucky in the sense of, think of it like this. If I tell you that I have shoulder pain and it hurts when I swim, let's just say that's the scenario.
Okay.
Right? But Elaine, I can do this.
Gotcha.
And I say, well, I thought you had shoulder pain.
What the heck?
What the heck? What do you mean it hurts when you swim? What that points to in my experience after doing a lot of this is what we call like a conditioned response. It's a sensitized central nervous system that is associating swimming with pain for whatever reason, but mechanically, your rotator cuff, can do whatever it needs to do in an isolated fashion. But as soon as you connect it to some other activity, it starts to associate it with pain. Then the question becomes is, if you don't have any reason as to why it started, what could have gone so far structurally wrong to be causing this? And the answer would be probably nothing. Right?
Nothing.
And so then if we can agree that probably nothing, because you don't recall doing anything weird or having anything else funky happen, right? Then we have to say, well, what is the cause? Well, is the cause a disc problem, a joint problem, a this problem, a that problem? Well, your motions aren't yucky. So you can stress your joints and everything and be fine anyway. And so then it becomes, okay, well, could this be of the mind? Now, what motions or what activities are you avoiding? Any?
As I'm sitting here talking to you, my right sits bone is starting to do its ache.
Good.
Yeah, good. I'm glad. Thanks, Chuck.
So now, okay.
Thanks, Charlie.
Let's do something. We could say, hey, I've got this in my butt. What is this? Well, nobody has their hand underneath a rock. Good. And we like rocks, right? Right?
Yes, I love rocks.
Okay, great. So you're sitting on a rock. Okay. Now, maybe is there a certain place that you visited that you like?
Sure, the beach.
Beach. Okay. Are there rocks on? It's a seashell. So now you're sitting on a seashell. Okay. And so maybe what you do is this is how you would do it. You might say, okay, as I'm sitting here, right? What are you noticing in your right sit bones? I'm noticing this. I'm noticing gripping. I'm noticing tightness. Just describe it.
Just kind of. It's going away already, Charlie.
We don't need to continue then.
I don't feel anything right this second now. I don't know what happened.
Okay, good. That's okay.
Weird. Freaking weird.
Okay, you're more powerful than you give yourself credit for, my friend.
I guess that's weird.
Yeah.
What just happened? What the heck just happened?
So what happened, number one, very briefly, what happened is notice how for a second you said, it's just like my right sit bone. It's just doing this. And I said, yeah, great.
Right. And I said, yeah, great.
Yeah. What are you afraid of? I love rocks.
I love rocks. I love shells. I love bugs. I love reptiles.
You're sitting on a seashell and it's a little warm. And you know, it's just, you look, oh, there's a seashell. Okay. Get the seashell, go. There it goes. Seashell is gone. Throw the rock, skip the rock. It's gone.
Wow.
So difficulty finding clear and consistent yucky motions, just like I shared and highlighted in the cases we just reviewed, is a sign that your symptoms are being driven by your brain, not your body, right? And the third and final clue, all right? Failure to respond to motion or treatments aimed at fixing the physical body are a sign that your symptoms are being driven by your brain, not your body, all right? So think of it like this. Imagine you're driving around one day and you hear a squeak coming from your wheels or coming from the front of your car, right? Initially, a lot of people would probably say, well, maybe it's my brakes. Maybe I have some squeaky brakes, all right? So that's where we're going to point the finger, but it's still a hypothesis at this point. So you go ahead, you change the rotors, and that doesn't really work. And then you go and you change the brakes, and then you change the calipers, the pads, things like that. All right, and you have this entirely new braking system by the end of this. Right? But the car is still squeaking, huh? All right, is it still the brakes? You thought it was the brakes. You replaced everything about the brakes. You went to the best brake mechanics, but guess what? The car still squeaks. Is it still the brakes? You must be left scratching your head, right? Maybe it's something other than the brakes. That's where the logic would bring you. So car is still squeaking, but I fixed the brakes. Could it be just my tires? I've got this new rubber, right? Could it be my tires? Could it be something in the fender? Could it be these fancy aerodynamic things that I have popping off the front of the car? Or you should start to think of other potential reasons or explanations for why it's squeaking. That is, if you can come up with these other reasons, if you're aware of these other reasons. All right. So again, hey, it's the brakes, but we fixed the brakes. The squeak did not go away. Right. And so you're probably watching this because you're like, hey, it must be the body. Here I am. I've got pain. It's in my back. It's in my butt. It's in my leg. Right. There's a physical thing going on here because I'm going to take my finger. It hurts right here, Charlie. There's a squeak, right? Something within my body is not working well and it's sending pain signals, right? And so what am I going to do? I'm going to take a microscope to it. I'm going to take pictures of it. I'm going to get x-rays of my spine, of my hip. I'm going to get not one MRI, but oftentimes we'll see it. People get many MRIs. And because I've got pain right here in my body, I'm going to go chase those symptoms and I'm going to try everything under the sun. And so this might be you. You're here on YouTube watching things. You go to Google, your family doctor, pills, shots, x-rays, the PT, piriformis stretches, planks, press-ups, tennis ball massage, spine specialist, more images, disc problem, degeneration. They label you with all kinds of things. You get different tests. Then the back doctor sends you to the hip doctor. Well, maybe it's this, maybe it's that, right? Then you go and you get massage. Then you go and you try yoga, myofascial release, the chiropractor, new mattresses, acupuncture, and it goes on and on. You've seen everything and tried everything, but nothing's working, right? And so you're like, hey, my pain is here. It's got to be a problem within my body. But your body is still squeaking, meaning the pain signals are still being experienced. You still have symptoms. Well, is it possible then, maybe you're not aware of it until this video, that your mind could actually be driving the symptoms? Could it be my brain? That I have a central nervous system that is a bit sensitized. I've actually learned to experience these symptoms. And these symptoms are not a manifestation of damage in my body. They're not due to a structural issue or an issue within the tissue with my disc or with my joints or with this or that. But is it possible that they're more psychological in origin? Is it possible that the brain is causing the squeak? And again, about 50% of the people we work with, this is actually the case. All right. So don't overlook it. And that's why I created this video with some real life case studies so you can resonate with these folks. All right. So in summary, all right, we are biologically wired to believe that all physical pain, all squeaks that we experience, right, is or are caused by a physical problem within the body. Pain equals damage in this case. Herniated disc, piriformis syndrome, sciatic nerve sensitivity, arthritis, stenosis, all these things. Right? But this simply isn't true. Sometimes it is true, but sometimes it isn't. We talked about the differences and how the response or the lack of response to movement interventions and to, hey, when I do this, it feels good or it doesn't feel good, yucky and yummy emotions, and the things, the positions or the activities, the pain triggers that I experience. What's the relationship between those? And what are some different clues that point to it being more of the brain than the body? So in many cases, pain does not equal damage, but rather danger. Folks stuck in fight or flight mode and they have physical symptoms, which are really a manifestation of the mind. They are very real. They are not made up, right? But treating the body doesn't generally work all that well, all right? So a false alarm by the brain to protect you from some perceived threat or danger is many times what symptoms may be caused by. And these are just a few clues, right? So clue number one, yucky emotions, which are inconsistent with yucky positions or activities. Things just don't match up, which is probably why doctors can't really figure it out, are a sign that your symptoms are being driven by your brain and not your body. And the coolest thing about this video is it helps you connect the dots between, we don't just look at this psychologically, right? We don't just look at this physically, but we actually use the physical evidence and what we know about the brain to put this together to help you come up with, diagnostic clues or evidence that my symptoms are this or that, right? The second clue, difficulty finding clear and consistent yucky emotions, is also a sign that symptoms are being driven centrally not by your body, right? And the third clue, failure to respond to mechanical or physical treatments aimed at fixing the structural body, is the final clue or sign that your symptoms are more likely to be of the mind than the body. All right. So these three clues, again, are a reminder that the fixing is in the doing. Everybody just wants to get to the outcome, to pain relief so quickly, but there's actually value in collecting feedback, right? And even if you don't respond to something, instead of getting freaked out and trying other things, don't ignore what that data is telling you. Look at the data, look at your belief system, look at the results that you're getting, and via help from someone like myself, start to say, what does this mean? What can I learn from this? Maybe I didn't get better, but what is this telling me? All right. And so this is why we walk people through a pain relief process. The fixing is in the doing, right? You can't just be fixed without doing things and without being able to look at the data you're collecting from doing those things and the response from doing those things, favorable or not favorable. There is no such thing as failure. There's only feedback. We can look at the data, stay very scientific within the confines of a process that has been tested thousands of times and help you collect the data you need to determine what's going on and what you need to do about it. All right. So I challenge you to be a scientist. Step one, we don't just start with movement as medicine, although you can see it, that definitely aids in determining the most likely source of symptoms. But we start with optimizing things mentally and physically, and in beliefs, fears, worries, concerns, doubts, questions you have around what's causing your pain. Physically, sometimes you just don't know what you don't know as far as habits, routines, things like that. If they're nicking a scab and keeping you from healing, we've got to do that first. The idea is you cannot exercise a bad diet. You can do all the motions you want here, sort of in this third part of the process. But guess what? If you're constantly doing things that are making you worse and you're not aware of it, you're going to keep yourself from getting better. Secondly, scan the body. I showed you how to do that and how to be objective about this measurement process and help you pull out the key metrics, right, that we look for to determine, hey, what's the relationship between these things? Does it make sense or does it not make sense? But then also something you can track logically and systematically moving forward so you can be more objective versus emotional. You can't manage what you don't measure is the idea. So what are you measuring or tracking throughout the process of attempting to become pain-free? So you know if what you're doing is working or not working. If you're not measuring something, it's going to be really hard to figure it out. The third step, using movement as medicine, and also just movement as a data point, right, to help us do some detective work and identify if things make sense or don't, and then also help us understand what that might mean for you. That's what this video was all about. And then finally, right, we've got to get you back to life. So pain relief can often happen very quickly, but then we really care about the long-term process to set you up for success such that you feel confident knowing what to do, not only now, but then also in the future preventative-wise. All right, so that is the process we use to help people all around the world with back, butt, sciatica problems. If you enjoy the scientific and systematic approach that we talked about today, if you see value in working with somebody who not only understands the role of the mind on pain, but also the body on pain, and help you connect the dots between the two and help you understand why what you're doing is working or not working, we would love to review your case to see if we can help. So again, we work with people all around the world with back, butt, sciatica issues. If you'd like me to personally review your case and you'd like to set up a time to chat with us, as in you're interested in potentially working with us, click the link below somewhere in the description or the comments, answer a couple brief questions and follow instructions to submit your case for review. So that's all I got. Thanks so much. Let me know your thoughts in the comments. Was this helpful? Was this not? Also subscribe for more like videos. And if you need some help, go ahead, click the apply link below. Thanks.